So when you're looking, take a peek at those. Then you have what's called fluff gauze or Curlex, or it's also known as bulky too. These are super absorbent. So I was fortunate to take a combat trauma class, okay, in San Diego. And of all the supplies we used in all the blood and gore that we were exposed to, this was my initial pull out of my bag. Okay, this is absorbent. It wraps, it holds. You can do a pressure dressing with it. You can wrap a head with it. This is amazing stuff. Okay, has a lot of good purposes for it. You just probably don't want to dress, routinely with it. Okay. All right. Any questions on gauze dressings? So this last one is called like fluff dressing, or it's called Curlex, is a brand name, like Kerlix, or bulky, like Bulkee, and then 2. Okay. All right. Yeah.
What about the stuff they put, you give blood and it's colored hot pink and
Oh, yeah.
can you use that?
Yep. So, yes, I will. Yep. She's asking about the self-adhesive tape, the stuff that when you get a blood draw, it doesn't stick to you, it sticks to itself. It's called Coban, or it's called, I have to call it self-adhesive tape because I don't use Coban's brand, okay? But essentially, it will wrap anything. Like you can use it to wrap a dressing. You can use it to wrap, like if you had to make a finger splint out of something like that, you could wrap it, buddy tape. You could use it to secure a splint. These have great uses, and this is super handy to have. This is a 2-inch wide. They come in typically 1, 2, 4, okay? But this is usually pretty adequate. Good question. All right. Where to put my clicker? Okay, so what are we trying to do all of this for? Okay. If you've ever had an infection, it's miserable, isn't it? It hurts, it's hot, it's painful, it keeps you awake. Sometimes you have to go to the doctors to get antibiotics, sometimes even IV antibiotics. These are the signs of an infection. Out of all of these, what's most indicative of the fact that you probably have an infection? Because when wounds heal, they can look kind of pink and red, right? It's kind of hard to tell initially, especially if you have stitches or staples. It'll feel warm to touch for sure. But what's the one sign that out of all of these that might just say this is an infection? Pus will be evident. Yeah, that's pretty, or may not be evident.
Fever.
Yeah, fever means it's more going through your whole body, and that is very indicative. But if you're wondering and you're like on the fence about it, it's the pain. So if the pain, and it's 3 days out and it's hurting more than when you did it, and it's getting worse, it's the pain that's kind of your big red flag. It does, it feels hot, you're right. All right. I'll tell you, I've talked about this before, but after the earthquake, I went to Haiti on a medical mission, and we went quite a few weeks after. We had to do some fundraising and stuff. People were getting more sick from infections than most injuries that we saw. They didn't have access to clean water. So even a mild cut could turn into something big. So in your emergency preparedness plans, always wear gloves, overdo it. Don't take risks of hurting your hands or any other part of your body. Okay, I'm gonna touch on burns. This one is tricky because I don't want to go into too much physiology and spend too much time here, but basically there's 4 different types. So a 1st-degree burn is like your sunburns. Okay, they hurt, they can be painful, but you're gonna live, right? You use some topical stuff and hopefully it gets better. The 2nd-degree burn is going down to the next layer of your skin. So the burn wants to keep going down to all of your layers. So how do you arrest these burns? Oh, on this? Oh, on the gauze. You guys okay? Bear with me for just a minute and get a repeat. They say you have to hear something, what, how many times before it sinks in anyway? Okay. Okay, for my friends online, we were talking about having this non-adherent dressing in your kits. It comes in different sizes, like 2x3, 3x4s. And it's kind of like a Telford, like it's a plasticky fill. So it's not going to be absorbent, but it's not going to stick to your wound either. So when you put the ointment on, you're going to want to put that on next when you go to dress the wound. All right? Then you're going to have different sizes of gauze in your kits. You'll have 2x2s, 3x3s, 4x4s, and they're all going to come in different plies, 2-ply, 4-ply, 8-ply, a 12-ply. So pay attention to that, because if you get, what is this one, 4-ply versus a 12-ply, I mean, they might say you've got 300 items in your kit. Okay, why is that? You do the math. All right, you're going to use more. What's also helpful to have is ABD pads. This is like an abdominal pad. It unfolds, okay? And they come in like 5x9s, 8x10s, trauma sizes. And they're absorbent pads, similar to probably like peri pads. But they're good for absorbing blood, and they're good for protecting and covering wounds. So these are super handy to have. The last one that we showed is the, we call it fluff dressing, or Curlex, or Bulky 2. And there's like 4.5 inch, 3.5 inch, and it's really absorbent gauze that's awesome for trying to control bleed initially, wrapping a dressing, a pressure dressing, wrapping a head wound. So these are really, really nice to have for more advanced bleeds. Okay, I think I covered it all super fast. All right, so we're moving on to burns. We're talking about first degree burns, sunburns, okay? Second degree is going down to the next layer. And we talked about how a burn really wants to keep going down. So how are we going to arrest that burn? How are we going to stop the burning process? Cool it off? Yep. And how are we going to do that? No ice. We're not using ice, and no ice, because that's going to vasoconstrict and it will do more damage. But that's, a lot of people think that, so I'm glad you said that. Like cool water. Yeah, not like warm, but not cold, but cool. And you want to do that for at least 10 to 20 minutes, depending on the burn. Because it's going to still, like you pull it out. Have you ever pulled your hand out of the water and then you're like, crap, it's still burning? Okay. It's because it's still actively trying to burn through the layers. So you need to be patient with these and let them cool down for like 10 to 15, 20 minutes, depending on the burn. Now, a second degree burn is going to differentiate from a first degree burn because it's going to have blisters. And you've got about 2 layers involved in this. Do we pop blisters? No. Okay, that's kind of like a natural Band-Aid. Just think of that as, don't open that up to infection. Don't peel it off. I know if you're a picker, you're going to be tempted. Oh no. Okay. Oh, hopefully that stays. All right. So, and there's different kind of levels within these levels, but third degree basically is going down deeper, is getting nerves and blood vessels. And in fact, they say that these burns don't hurt as much as the other burns because it's destroyed your nerves. The areas around it still might be first or second degree burns, and that area will hurt. But the deep tissue burns, partial to full thickness burns, they say aren't that painful. I would probably beg to differ, but I haven't had that kind of a burn. Then the last one is the fourth degree, and that's like going through everything down to your bone. Okay, they're intense. From fire, from steam, from all kinds of ways you can get those severe burns. But for first and second degree burns, the treatment is the same. That's all you have to remember. If the skin is still intact, you're just going to cool it. All right, you can put something, a loose lint-free dressing over it. They have, these are in the kits, they're like lint-free, extra large, like triangular bandages, if you will. Okay. Or you can just wrap it with like a saran wrap around it or put some Vaseline on it.
Never mind. I was just looking at petrolatum and it looked like petroleum.
Oh, petrolatum.
Petrolatum.
Yeah, petrolatum. It's another word for Vaseline. Same thing. Okay. Oh, thank you.
I am super curious. Why is Vaseline different than like oils or butters?
It's a good question. I mean, in every class I teach, people will always say butter. And I think that just traps the heat where the other one is more breathable. So chemically, I couldn't tell you. Yeah, I don't know. I'll have to look that one up.
You'll taste better and you might want to chew on it.
Yeah, that's right. Very good. Okay. Now, this is a busy slide. You don't even have to look at it. But basically, if you get a burn that's covered your hands, your face, your genitals, your feet, if you're a kid under 2, if you're over the 50, or if it looks like it's gone beyond a 2nd-degree burn, then get medical help. I cannot begin to emphasize enough how serious 3rd and 4th-degree burns are and what your body goes through and the shock that it goes through and the fluid distributions that are happening to every organ in your body. So don't just try to treat those yourself. Don't ever put anything in them. If it's really deep, just cover it up and go. Don't put anything in them. Like, you don't even have to put water in them for right now. Okay. Okay, how many of you have ever had a sprain? A fracture? They hurt, right? Have you ever been on vacation and have it happen when you have absolutely nothing? Okay, so that happened. We were in Oregon on a very remote beach, and a gal was carrying her baby down this mud, and she fell and she broke both bones in her shin. And a lot of people were walking by, right? My daughter was there. And of course, who's their mom? Right? That's all I have to say. So we were able to create a splint out of towels. So we got all of our beach towels, put it on above the joint, below the joint that was injured, and was able to secure that. Now, there's some things, it's just not that simple. Because when you go to do it, I'll go back to that one, is you want to always check the circulation distal or beyond the injury. Because if you're trying to put a splint on and they have no circulation, you have a different issue going on and you're just going to compound it. Sometimes those bones can bleed really severely, especially femurs, and it can bleed so much that it puts so much pressure in there that sometimes they have to go cut you open so that that can drain. So you can lose your circulation from a fracture, from bleeding in your bones, okay? And this girl started with great circulation for the most part. I mean, she was obviously pale, and she had an open fracture kind of coming out down here. And I think it was an hour and a half before the volunteer EMTs showed up. And bless their little hearts, love them. But they showed up and they wanted to take my splint off and put on cardboard boxes that they had. And what does that create if you put on a cardboard box rather than something that's kind of forming to the body? Dead space. So what do you have to do with the dead space now? Yeah. So while we were waiting for the ambulance to arrive, we kept checking and rechecking her circulation. Pretty soon it was very diminished and her leg was very, very swollen. So she could have really very easily been developing like a compartment syndrome where she was bleeding into that. And it was really hard for me not to, tell them kind of like, this is really serious. We've got to go faster. But I hope she was treated and taken care of. So, but that's essentially what you do. You can use anything. You can use blankets. You can use towels. This one's pretty beat up, but in the kits are these SAM splints. These come in like 4-inch finger sizes to as long as 36 inches. So if I had to secure an ankle or, there's so many different ways you can put these splints on. It would take a couple hours of training beyond what we're doing tonight. But basically, these fold up and they're flat in your kits, so they don't take up much room. But if we had one of these, this has been really handy. And I usually have it with me wherever I go, and I'm really mad I didn't. But I didn't have it at the beach that day. Okay, so, you would learn how to properly splint and how to use these. Okay, you would splint the joint below and the joint above just to help protect it so it's not moving. Then you could tie it on using your triangular bandages or that self-adhesive tape. There's a fly in here. Or ACE wrap, the elastic stretchy wrap. So you can get really creative with how you do this. But just know that it needs to be immobilized. And, you don't want them to bear weight if at all possible, especially if they broke both bones, because what happens if you get both bones broken? Okay? Your leg gets floppy at the other end. Okay, it's kind of gross, and it sounds gross too. So when you do get an injury, whether it's a sprain, strain, or fracture, you're going to do the exact same thing. You've heard of RICE? Okay, rest, ice, compression, elevation. When you use ice, you're going to do it like 20 minutes on, 20 minutes off. And put something between your skin and the ice, because you'll get freezer burn and have another problem. Compression, just like ACE wrap or the elastic self-adhesive tape. And then raise it above the level of your heart. That will help with the pain a little bit. And of course, morphine. No, okay. I don't put morphine in the kids. I want to. Okay. So any questions on that? We're going to move into, we're going to go kind of fast through a couple of things because I need the last 15 minutes to go over some important things. Okay. This is kind of triggering, but I want you to listen to this noise, because if you recognize this noise, you're going to save a life, I promise you. Oh. Hold on. Did I not embed the link? Oh, I bet it got taken off. What it is, it's a bunch of babies that are showing signs of respiratory distress, and they're infants. And when an infant is in distress, it's gonna be evident by taking their shirt off and looking at their chest and their neck. And the skin between their ribs will either be sucking in, or they'll be doing some kind of seesaw, or head bobbing, or nasal flaring, where their nose is flaring. There's different signs of this distress that you can pick up early and then get them to the doctors. Do not wait on this. This has been the deaths that have haunted me the most in the ER, is the ones that if they had only brought them in a little bit earlier and recognized the signs of respiratory distress, because babies will go until they don't. They don't have a reserve like adults. So you'll hear this mostly with bronchiolitis, asthma, things like that. So when you're taking care of an infant, get them naked. That's the best way you can tell, because they can't tell you what's wrong, right? Do I have this one? Oh, I took out the things. Okay. Who will come up and be a volunteer for this one that does not have asthma? Come on. Okay, come on up. He's a good guy. Okay, don't breathe through your nose. Put that in your mouth and just breathe through it normally. Okay, I'll give you a few breaths. Doing okay? Okay, not a big deal, right? Don't breathe through your nose. You getting a little panicky? You feel a little oxygen deprived? Okay. This is how an asthmatic feels. Their airways, thank you. I don't want you to pass out on me. We'll have a whole problem. I know, I can show you real life how to do it. So your airways in asthmatics are so inflamed that they're shrinking and they're getting all this mucus in them. So it's really hard for them to breathe. So with asthmatics, you want to get them calm and comfortable and sitting in a position that feels good to them. You want to know and ask them where their inhaler is. It might be red, but it's a rescue inhaler, albuterol usually. And they just put that in their mouth, seal their lips around it, and give themselves 2 puffs, okay? This is a spacer that they can put it in that'll just help them give all the medicine, okay? So that's if you see some foreign looking body, but really this is the most important thing to get. So if you have friends at school, say, go get my inhaler out of my backpack. This is what you're looking for. Okay. Okay, allergic reactions. Who in here has anaphylactic reactions to something? What is it?
My throat pulls up, my nose pulls up, my fingers look like hot dogs.
Have you had to go to the ER for it?
Yeah.
What is it? What is it you're allergic to?
I have spontaneous anaphylactic.
Okay, so she's got something kind of fun. It's called spontaneous anaphylaxis. So that's scary because she doesn't really know what's triggering it, right? Most people would know. Like maybe the first time you get stung by a bee, though, you're not going to have the reaction, but the second time is more severe. So just because you got stung once doesn't mean you're not going to eventually develop a sensitivity to it. So if you have an anaphylactic reaction, it can be really, really serious. Some people with far as latex allergies, they just have to be in a vicinity of somebody who took off a pair of latex gloves and it got aerosolized into the air somehow. That's all it takes to trigger it. So these people will get hives that look terrible. Their eyes might look swollen. Their lips might get edema or swelling. They might complain that their throat feels like it's closing off or it gets scratchy. They might have abdominal discomfort, watery eyes. But when this happens, it happens really fast. It's like, oh my gosh. I mean, something inside of you is saying something's not right. So you listen to that because even though if you don't have the training, you know this person, you know something's not right. You know best. So most likely, if you know that you have an allergy, this is an EpiPen. She probably carries it with you wherever you go. Yeah. Okay, so you can tell us, where does blue go? Where does orange go?
Orange goes in your thigh.
Okay, so blue to the sky, okay, comes out. Orange to the thigh. Good job. Okay, and if you have a thin layer of clothes on, you just jam it right in there and hold it till the medicine gets in there. That's it. It's a little needle. It's not bad, right? Okay. Okay, the problem is this maybe lasts 15, 20 minutes and the allergic reaction might last a lot longer. So what's going to happen when you think they're getting better? It can come back. Then you're going to need more. So hopefully you have the ambulance on the way if they don't have a second one. Okay. So treat those can be really serious because once they come in and their throat's closing off, it's really hard to intubate them and get airway. Okay. I'm going to touch briefly on drug overdoses. Yes? Yeah, yeah.
In the ER, they told me that the first 24 hours after, it can recur.
Yeah.
Just spontaneously. So just to have your family on alert.
Good point. She said that after an allergic reaction, once you're discharged from the hospital, that 24-hour period is still one that you want to be really aware of it returning or rebounding. So make sure you have family watching you and you're not alone. Narcan, you probably hear about all of the fentanyl deaths taking place. We have kids that it's been used on twice in church parking lots. It saved lives. It really does. I have it in my car. You can have it in your car. You can get trained on how to administer it. There's libraries that will give it to you for free. You can Google which facilities will give it to you and you can carry it. It's usually good for about a year. But you put a squirt in the nose on both sides and it helps move those fentanyl drugs off the receptors and then it gets an antidote on there and they come around really quick. But again, this might not last as long as the sedation from the narcotic. So always be calling 911. These are apps that you can put on your phone, and I recommend that you do. The last two, the poison control app is awesome. So if you can get right online immediately and connect with someone, or you can see what to do if you get a chemical in your eye, if you swallowed whatever, and it will give you all the answers. So that poison control app is really good. If you have animals, have this app. They get into all kinds of naughty things. Okay. Okay, choking. How do you know if I'm choking? You're going, yeah. You're going like this probably, right? This is the universal sign for choking. If you have a 1-year-old or less that's sitting in the high chair eating grapes, this is my biggest nightmare as a grandma. My grandkid's in there and chokes on something, okay? What do you do with that baby? Do you scream and run over to the neighbors? You can call 911 and hopefully maybe somebody is, But this baby has how many minutes before really brain death? Okay, it's not getting any oxygen. So you have to act fast. So you can pull the baby out of the chair and you're going to start back blows, okay? It's kind of hard to do and stand up. But right between the scapula, you take that CPR hand that you're going to do compressions with, and you're going to do 5 back blows. 1, 2, 3, 4, 5. Kind of hard, okay? Then you're going to sandwich them, and you flip them like a pancake, and then you do chest thrusts. 1, 2, 3, 4, 5. And you do it this way, not that way. And you keep repeating, okay? 3, 4, 5. I'm sorry we can't spend much time on this, but this is what you learn when you take a CPR class. You learn how to do this and practice it so you're comfortable with it. But that's all you do. Now, as an adult, come on over. Okay. So if he was choking, and I could tell, I would run up to him and say, hey, my name is so-and-so. I know first aid. Can I help you? Otherwise, it's assault and battery, right? So we want to consent. Okay. Well, not if it's my husband, but you know. So what I'm going to do is put my arm under him like this. Okay. I'm going to tell him to bend over. I'm going to stand on his side like this. Take that same hand, same area as the baby. 1, 2, 3, 4, 5. And then I'll have him stand back up. I'll pivot, put my leg between his, find his belly button. Okay. Go 2 fingers above it. Abdominal thrusts. And I'll shift over to the side, bend over, keep repeating it until it either comes out or he passes out. Or I pass out. One of us will. Okay. Thank you. Here's your glasses back. Okay. All right. Yep. There you go. This one? Okay. Yep. Okay. Yes.
There's just a whole lot of hype lately about these inhaler or things that look like an inhaler. You pump.
Yeah. There's different brands, like I think LifeVac, things like that. Okay. So he's asking about those anti-choking devices that you can just suction. You just suction it out. And in theory, it sounds great. I've watched a lot of, read a lot of studies and things like that on because I want to know myself. So it depends on which one you have. There's some that have mouthpieces in them that just get in the way. It's not good. Some people have had really good success, but overall, it shouldn't be your primary go-to. Now, do I have it as a backup method? Yes, I have it for my grandkids, just in case, because you don't want that feeling of helplessness, and I want to be able to do something, you know. So that's a personal decision. They're very expensive, like between like $40 to $70 to $80. As a last resort, it might not hurt, but they're not been really tested hardy, robustly to be able to give you a great answer on it. That's a good question. All right. I'm going to show you this first one because I want you to hear this noise. So there's a difference between just gagging and choking. Smell like. Okay, so if a baby is like choking, there's none of that inspiration, expiration. It's just, there's nothing, okay? This video is a teenager who just barely took CPR who saved his buddy's life. Okay, he just walks around like no big deal. Does the Heimlich, because everyone's just panicking around him. Nobody's doing anything again. So he just gets up, does his thing, sits back down, and is done. Okay, this is the 2-year-old where a mom picked him up and just started doing back blows on him, and it saved his life. Okay. Oh my gosh. I don't know where the rest of my presentation went. There we go. Okay. If that comes back up, there's going to be one more video I want you to watch. And, oh, it's a really important one. Okay. Okay, we're going to talk about chest pain. This can impact any one of us in here. At any moment, we're just kind of all little ticking time bombs. I need you to see how CPR
Our heart is an amazing
is
organ.
working in your body.
It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can and don't give up until medical help arrives or an AED is present. You can do it.
Okay. So you can see why compressions and hands-only stuff that's coming out is just genius. Because I think a lot of people didn't act because they didn't want to do mouth-to-mouth. Because generally when somebody, for lack of better words, codes or dies, they'll probably vomit. And it can be kind of like not good. So you either carry a barrier and you choose to do the airway and breaths, or you just do hands-only compressions on adults. This is having a hard night. We don't want that. Okay. I don't know what the deal is. Okay, so essentially what I want to get into the last few minutes is I want to talk about these kits that I want you to go home and look and see what you have. All right? And I'm not doing this to sell kits. I am doing this to educate you. I promise. These throw the whole kit away if they come in your kit, because it's going to have non-sterile gauze. It'll have vinyl gloves that aren't really helpful. It'll have tape. I don't know what you're going to do with that. It barely peels. It'll have like these little cotton tip applicators. I have no idea what you're supposed to do with those. Band-Aids that really don't stick or old, or gauze that is like minimal ply. They do the very bare minimum and give you the very cheapest stuff because they make huge markups on this stuff, or they charge you astronomically for the bags. Scissors is my my big thing. I will not put any kit together, even the kids' kits that I do when we teach kids classes. They get a nice pair of trauma scissors. So hopefully they're not attacking their kids' siblings with it. Okay, this will cut off any clothes, coats, shoes, because you need to expose your injuries. Okay, if you're going to put on a tourniquet and they have a big parka on, you got to cut it off. Okay, is this going to do it? Okay. I was trying to do CPR on 2 kids on a freeway and nobody was coming to help. I did not have any of my trauma supplies with me. I needed one of these. Finally, a little 13-year-old came in and said, "What do you need?" And I said, "I need scissors." And guess what he brought me back? This is what I had to try to extricate a little infant upside down in a car seat with because it wasn't coming out. It took a minute, and I'm sure that he got a little oxygen deprived because of the length of time, and it was a horrible situation to be in. So my best advice is always to keep a pair in your car. Even if you don't have a first aid kit in your car, keep a good pair of trauma shears so you can cut out of anything. These are nice just because they have a seatbelt cutter too. Okay, and they'll cut through anything. So you can spend as little or as much as you want. They're not that expensive, but just have something that's going to be reliable that will get you out of a bind. Okay, that's my 2 cents on scissors. So now that you know what doesn't work, you have a little bit of an exposure of the things that do work. Think about your kits. What do you need to upgrade? What do you need to replace? Do you not have one? Some of the questions you need to ask yourself before you answer that is, what do you guys like to do as a family? Are you boating, hiking, traveling? Are you in the car in the winter a lot, traveling long roads between here and Wyoming? Okay, that's going to make a difference. You don't want a cookie cutter kit. I mean, I don't want to come to you and say, "Here, buy this. You're good." That would be like you handing me a big old toolbox and saying, "You're good." It's not working like that, okay? I don't know what you do in your personal life. You might be, I don't know, whatever, you know, and you'll need something completely different. Something that will get him out of a bind in a very cold situation or something like that, okay? But, oh, I wish this would work because it has a perfect example on it. Maddening. Okay. So anyway, my take home for all of you tonight is to take one thing that you learned and to share it with at least one person, okay? I want you to look at your kits and consider asking yourself those questions and figuring out what's one supply that you could add to your kit or upgrading your kit. Or if you don't have one, I would encourage you to take advantage of the ones that the Food Storage Depot has put together for you. They have a very extensive first aid kit with a tourniquet, because like I said, I'm not selling any without a tourniquet, okay? On sale tonight for $3.79. And these big, massive ones are medical and trauma kits. So you get all the trauma supplies and all the first aid supplies. And it covers more body systems, you know, eyes, flushing, like all burns, like everything, okay? That one's $6.24 on sale. Now, you might be going, "Oh my gosh, that's ridiculously expensive." And it is. You know, I don't know who has that kind of money. It's hard. But what you're paying for is you'll get the skills, you'll get the knowledge because we'll support you. You'll have the right supplies, so you won't have to wonder if you have the right things. And it's a great foundation if you're going to start out with a good baseline, because you can always modify it and upgrade it as you go. And more, the Food Depot is going to have opportunities for you to be able to do that. Tonight they have just a little wound care kit that's been put together. Yeah, you want to get it? And I think they're selling it for $12.95 on sale tonight. It's a good price for one of these little things. And then I love My Medic. I use a lot of different vendors. There's some things I don't like that they use. I use North American Rescue. I won't use anything less than their approved trauma supplies. But when it comes to first aid guides, this one is really good and it's updated and it's accurate. So this is on sale too for $12.95. They're normally $14.95. Okay, but this also will have a QR code on the back so that you'll have a digital copy wherever you go. Okay, so if you get one, just don't say, oh, okay, I got it, put it in your pocket. Read it and reread it and visit it again. Ask questions. You know, go to reliable resources if you do have questions, if you're not getting your questions answered. What we also do, the right stuff, is we'll do CPR training for infants, child, and adult. We do kids classes from ages 5 to 19. We'll do private family sessions in your home. We'll come to your home. We'll do presentations on many different topics. Each one of these topics we touched on today could easily take another hour and a half to 2 hours on each one. So you got the fire hose version tonight, trust me. And we covered this much. We didn't go over exposure injuries, hot, cold, like there's so much more. So as you're sitting down and you have spare time, maybe click off TikTok and maybe just hit up some educational videos or commit to learning a new skill. Take a Stop the Bleed class. We'll offer those for free. Take a CPR class. Get the why behind it so that you can do it accurately and it'll get set in that muscle memory. Can you see how important that is? In all of those scenarios, those people had a recent training within like 10 days of saving a life. Imagine the outcomes if they had not had the training. No point in buying one of these if you're not going to learn the skills. Okay. Is there any questions for anybody online here tonight?
Working? Oh, what's it? It's back on?
Yeah.
Oh, yeah. Okay. You did kids classes all summer here.
We did.
So we can schedule that
Yes.
again if there's some interest, right? And
Yes, we just need to know that there's an interest, because what's hard is we'll set up these classes and we might have one child or three, or two. And we want to fill these classes up and get, 10 to 12 kids in these classes. They're so smart, they're so capable, and they don't have opportunities to learn the confidence and the leadership skills that they need to keep themselves safe and do a scene assessment and call 911. I can guarantee you not one of the kids in the class knew the grandparents or the caretaker's address when they called 911 when we played on the phones. Okay? There's so much value in teaching these kids, and there's not as many opportunities like Boy Scouts and things like that for them to learn these life skills. That's all they are, is life skills. So thank you for bringing that up. We'll have, if there's a group that's interested, we'll do it in a heartbeat. So they get to go home with their own really nice first aid kit too. Okay, any other questions? Okay, well, thank you for spending your night here tonight. I appreciate all of you. Go and do good things.
Thank you, Lisa. Thank you. Okay, good night, guys. Yeah, if you need anything or want to go through the store for anything, whatever. And everybody online, you guys can call tomorrow or email me at info@Thrivalist. We'll still offer those deal prices. That's also on the website. So at the sale prices.